Hello, Long Beach. This is Mayor Robert Garcia. Today is May the 1st, and this is our Friday update. We, of course, give city and media updates every Monday, Wednesday, and Friday at 3 o'clock p.m. And I want to thank Dr. Davis from the Health Department, who's almost always with us, who's going to answer questions, and, of course, give an update also on testing today. And we also have Alice Castellanos from the Long Beach Health Department, who's going to translate at the end of the questions in Spanish. So en español también vamos a tener at the end. And of course, Paola, who's doing our ASL translation, is always with us. So let me start, as usual, with a little of an update and the data. First, I want to just thank everyone for your patience. I know that this is an incredibly stressful time, especially if you are a worker who's unemployed or a small business owner who is anxious to get back up. This is a very hard time, and we understand that. But I want to thank Long Beach. Vast majority of our community, I mean, really the entire community has been so supportive. They have been following our stay-at-home, safer-at-home orders and guidance for the most part, and there's a sense of support for each other that you're not seeing everywhere else, but you are seeing it here, and I want to thank you for that. So what do our numbers look like as of today? As of today, we have 709 Long Beach residents who have tested positive for COVID-19. That's 709. The good news out of that 709 is that 424 of that group has recovered. So 424 of the 709 has recovered. And in the data I'm going to share, there is both good news and other news that we should be more cautious about. The number, of course, for positive rates continues to go up, and that's to be expected. We have dramatically increased testing across the city. And so now with all of our testing sites, we should expect to see more and more positive cases. Should we be alarmed? Absolutely. But it's also a sign that we are testing more. We want to know if people have COVID-19. So that is a positive thing, is to get everyone that we can tested as soon as possible. I'm also heartened that in the last couple of days, the last 2 days, we have not lost anyone to COVID-19. There's been no new reported deaths that we have. That's not to say that we won't get tragic news, over the weekend, because we expect that we will have more tragic fatalities, more deaths. But it is heartening to know that we haven't had any in the last couple of days. And I will also share with you something on hospitalizations. You're probably seeing some of the data that's on the screen right now. Hospitalizations actually is something that we're looking at very carefully. And I mentioned this the last time we talked. We're at about 54 individuals right now that are in the hospital right because of COVID, that are obviously fighting to get healthy. That number was 58 a couple days ago. It's remaining in about the mid-50s right now. But as a reminder, just a week ago, we were in the 40s, in the mid-40s, and 2 weeks ago, the low 40s. And so that hospitalization rate has not begun to decrease. It's actually, if not plateaued, is certainly slightly increasing and just kind of right around those mid-50 numbers. So we're going to watch that number very carefully in the next few days to see if the trend of hospitalizations is increasing, or if we really are reaching that top of that curve, and that we really are flattening that curve. So hospitalizations are a really important, critical part of the data we're looking at. And I want to share another piece of information I was asked earlier on. We know that the largest part of our outbreaks have been at our skilled and nursing care facilities. Was asked earlier today how many we have in Long Beach. So we actually, for a city of our size, have a lot. So we have over 90, I believe it's 93 skilled and nursing care facilities in the city of Long Beach. Of those 93, there's 11 currently that have active cases of those 93. And we're watching those very carefully. The city is providing almost all the PPE to all of these facilities. Every one of these facilities is being tested. and we're carefully working with the staff to ensure as safe of a stay for these vulnerable seniors and residents. It's really tragic what's happening in some of these places, but I wanted folks to understand the scope of what we're dealing with. It is very serious, and we're working with our partners. Testing. Again, I will share that this is a bright spot of what Long Beach is doing. We have one of the more robust testing programs. The governor recently, of course, announced that he was opening up 80 testing sites across the state. You probably read that in the newspaper. Our testing site, the Jordan Plus site that opened, I think, yesterday on Thursday, which is the kind of not Jordan High, but it's the annex. It's the Jordan Extension site, just a little north. That was the first of Governor Gavin Newsom's 80 testing sites to actually open. And so we were the very first one to get open. I know that the state, the governor's office is very appreciative of that. And so we got right to work and are testing people at that site, including today. As of yesterday, we had run over 5,200 tests at all of our sites across the city. And along with the over 4,500 tests that are happening at some of our private centers, we're close to 10,000 tests that the city has run through the beginning of this epidemic. And in addition to that, I want to share that today, our Long Beach City College Liberal Arts Campus drive-through testing center is open. So this testing center is our first testing center in East Long Beach. It's really the last piece of our puzzle to get the entire city coverage. We have testing in East Long Beach, in North Long Beach, in the center of the city, closer to downtown, and in West Long Beach. So we are well spread out across the city. This testing site at Long Beach City College is now open and taking, of course, appointments. You can sign up for an appointment at longbeach.gov, on the COVID site, on the testing link, and sign up today for an appointment. And as a reminder, we are encouraging, if you are a frontline worker of any kind, if you're one of our nurses, medical staff, a home care worker, working in any capacity out there on the front line, a firefighter, please get tested, whether you have symptoms or not. We have that capability, and you can find more information on the site. And again, I want to thank all of our partners. First, the hardworking team at the City of Long Beach. Those that are managing and operating these facilities are not just health officers, but lifeguards and firefighters and other workers from all across the city family that are doing other jobs under this emergency. And I want to thank you for operating these centers. And again, our Medical Reserve Corps volunteers. Our Medical Reserve Corps is a group of medical professionals who have experience, who are volunteering their time. These might be former nurses or former doctors or folks with medical experience, and they are also staffing these centers. So to our Medical Reserve Corps, thank you. And if you want more information about how to join this Corps, again, you can go to our longbeach.gov COVID site. And our partners that are hosting these sites, Long Beach Unified School District, Long Beach City College, St. Mary, LA County and the state of California and the governor's office, a huge thank you. We are now able to do over 1,000 tests a day, and would not be possible without your support. As I transition now to talk a little bit about reopening, we've been talking about this a lot. We know that people are staying safe, and I just want to remind folks that we can reopen faster when people follow our safer at home orders. And I think there's a lot of folks that are anxious and some that are upset or protesting, doing other things in other parts of the state. That doesn't get us to opening up faster. That doesn't allow us to flatten the curve. And so we want to make sure that in Long Beach we're doing the right thing, and we are, and I thank you for that. And as it relates to the reopening process, I've been saying that we're following the governor's 4 stages. We continue to be in stage 1, which is testing and preparedness, and we're feeling good about that, and we're transitioning on to stage 2, which is the low-level reopening process. As a reminder, you should all expect to hear very soon news about this next phase. I'm very optimistic that we're making the progress that we need to make to go into this phase in a way that is done in the safest way possible and being guided by our medical professionals here in the city, as well as our experts in business and safety and public safety. To those that have signed up and filled out our Reopen Long Beach survey, we have over 13,000 responses from the community. That's again on the website, longbeach.gov/reopenLB. Thank you. And that survey closes Monday, and we've collected an enormous amount of data. And I want to thank everyone that signed up and our entire economic recovery group also for the work that's happening. And they just had their second meeting this morning, and I expect that they're going to have recommendations to the city very soon. In fact, I understand could be in a few days their first set of recommendations. And I want to thank Councilmember Rex Richardson, Councilwoman Stacey Mungo, and Councilmember Dee Andrews, who serve on the Economic Development Committee, for a hearing they had yesterday on the recovery. They heard from a variety of individuals. I thought the committee did a great job, and thanks to them. And I look forward to hearing more from that committee, as well as our Hospitality Recovery Group, which is a separate group. Let me just wrap up by and pass this on just by saying how grateful we are to all of you. We are making a difference. We are beginning to see those positive trends that we want to see. I want to ask you this weekend to please be safer at home. Our beaches remain closed as they were last weekend. Our playground equipment in our parks remain closed. Most stores, of course, are closed. And if you need to go take a walk outside in your neighborhood, or you want to walk through one of our parks or walk with your family, those things are acceptable. Those are okay, but be safe. When you go out of your home, especially in public or around people or into a store, wear a face covering. And let's show our community and the state of California how a city that is responsible and cares for our most vulnerable acts and behaves responsibly. So thank you for that, and I'm going to turn to Dr. Davis.
Thank you, Mayor. Good afternoon, everyone. So I'm just going to go over and review our testing, because there's so much going on right now, so we'll just go over that. Like the Mayor mentioned, today, through a partnership with Long Beach City College, we're opening a new testing site at Veterans Stadium, where we have the ability to test 100 people a day through drive-through testing. This site will be open daily from 3 to 6 p.m. and is staffed by our wonderful Medical Reserve Corps volunteers. Also yesterday, in partnership with the state and Governor Newsom, we opened the site that we're calling Jordan Plus. This is located at 171 West Bort Street, B-O-R-T, Street in North Long Beach. Just a reminder that we have two sites that have very similar names. So this site is called Jordan Plus, and it's on the west side of the 710 freeway. The Jordan High School site is east of the freeway at Jordan High School. So the Jordan Plus site, the one on the west side of the 710 freeway, will be open on weekdays from 7 a.m. to 7 p.m., and it's staffed by the state. This site is walk-up only. There's no drive-through option. So now we have a total of 6 community testing sites when we include St. Mary Medical Center. And like the Mayor mentioned, they're dispersed all throughout the city of Long Beach. And for all of these sites, you can make an appointment by going to the testing webpage at our COVID-19 site, www.longbeach.gov/COVID-19. And you can also get assistance with making an appointment by calling our info line at 562-570-INFO 4636 from 8 a.m. to 5 p.m. 7 days a week. So I just want to review a few key features of some of our testing sites. So most of our sites are drive-through sites. However, we wanted to make sure that we were providing testing availability for those without cars and for those who don't drive. So at 4 of our sites, people now have the ability to walk up and be tested. So these sites are the Long Beach City College Pacific Coast Campus, Cabrillo High School, and Jordan High School. You can walk up or you can drive through. And like I mentioned previously, the Jordan Plus site is only walk up. You should still make an appointment through the testing page or our info line, but you don't need to have a car for these 4 sites. Just want to touch a little bit on the subject of testing essential workers. So these are individuals who are on the front line right now in responding to this pandemic, including grocery workers, critical government workers, public safety workers, our healthcare workers, and others. While our priority has been testing those who have symptoms, we've recently expanded that to offer testing to all of our essential workers, regardless of whether they have symptoms or not. So testing is now available for essential workers, even ones who do not have symptoms, at 3 of our Long Beach sites. And those are the Jordan Plus site, the LBCC Pacific Coast Campus site, and the St. Mary Medical Center site. Essential workers can make an appointment on our testing site or through the info line. There are pre-screening questions that are asked when people schedule appointments. And this is when essential workers can identify themselves. Just want to highlight a couple of things to our asymptomatic essential workers who choose to undergo testing. If you receive a negative result from this testing, that just tells you your result at that moment that you were tested. If you were exposed, it can take up to 14 days to actually develop an infection. So you need to keep watching for symptoms. So it could be that when you were exposed and you got the test, you just hadn't developed the infection yet. It also doesn't change anything that you should do. For instance, if you know that you were exposed to somebody with COVID-19 and you are self-quarantining at home for 14 days, having a negative test result within that 14-day period does not change those instructions. You still need to continue your quarantine at home for the full 14 days. I've also heard that some people want to be tested, some essential workers want to be tested because of their home situation. Somebody at home, for instance, is an older person. If you have a negative result, that doesn't change the care that you need to take because you live at home with somebody who's older or who's at some other kind of risk. And you still need to follow physical distancing, hand washing, not touching your face, and all of the other recommendations that we've been giving while you're out in the community, because exposures while you're out in the community are always possible. So to wrap up, we know that there's some confusion about Jordan and Jordan Plus, so I just want to reiterate. Jordan Plus site is on Bort Street, and that's where we're testing essential workers, and along with the St. Mary site and the Pacific Coast Campus site. At all of our sites, testing is still prioritized for those with symptoms, individuals 65 and older, and those with underlying health conditions. Thank you.
Thank you, Dr. Davis. And before we take questions, I just also want to just add that today is May 1st, May Day, and I want to thank all of the amazing and hardworking individuals that are out there, the working class, the working individuals that are running our economy the way it is today, to all the grocery workers that are out there, all the folks that are out delivering packages, to those healthcare workers, the nurses, the people that are out there in agriculture, picking the food that we're eating. Just thank you for your incredible hard work, your labor, and your commitment during this pandemic that really shows this country what really moves our economy, and that is working people in this community and across the country and state. So thank you very much. And with that, we will turn it over to take some questions.
Okay, first up we have Kelly from the Long Beach Post.
Hi, Mayor.
We've been getting a lot of questions about the moratorium on evictions, and with a lot of this stay-at-home order likely to extend past this month, could the city possibly consider extending the moratorium on evictions?
I think that the city council, as you know, that would need to be introduced by the council and so I can say that that discussion is happening. There's council members talking about not just the eviction moratorium, but other ways to protect renters and small property owners to ensure that folks aren't losing their homes and that people can actually stay in there. We don't want anyone to get evicted. Renters are right now in great distress. The weight of not being able to have money on the table is very hard, and so the council is looking at that, and I do expect some type of council action on that issue, and quite frankly, others in the weeks ahead.
Next up, we have Haley from the Press Telegram.
Hi, I actually have a couple questions about the process for reopening the economy. So first of all, Mayor, you've mentioned a few times when talking about stage 2 that that would include low density retail. And so I was just wondering if you could give me a few examples of like what types of stores would fall under that designation. And I also wanted to ask, you mentioned that the Restart Long Beach Task Force will be making recommendations pretty soon. So will those recommendations be made public?
So I missed, I think, the first part of the question. I think, was the first part of your question what examples of what low density retail is? Was that the first part of the question?
Yes.
And then the second part is would the recommendations of the task force at some point be made public? Is that right? Was that the question,
Correct.
second question? Okay, sorry, the connection was great. Well, all right, so first question. So what are examples? And so low density retail, as described by, obviously what the governor's been discussing, what we've been discussing is essentially smaller retailers that could provide physical distancing within their space and operate in a way that was safe. And so an example might be, let's say, a florist. A small floral shop. You might be able to go in and get flowers by distancing and having proper face coverings and the proper sanitation. Another example might be a small bookstore. That could be another example of a small retailer that you might be able to go in and support if there are proper guidelines, following it. Another example might be, I've heard a lot about car washes. Car washes are the type of retail that, particularly if they're automatic, if you can imagine, and there's not a lot of interaction, that could reopen possibly, or if it's just you and you're doing it yourself. There's different small kind of low density retailers that don't have a lot of interaction with the public that you can do from a safe distance. That I think is likely to be in that first stage. And I think those, if you think about, for example, small boutique shops, see smaller stores that you see really all across the city. Those are examples of places. I have heard from small business owners some incredible ideas on how to stay safe. Now, these ideas will have to be vetted through a health lens, and the Economic Recovery Group is looking at this as well. And so, when we take this next step, which is coming, we're going to put out, these are the categories, these are the areas that we think can have this phased-in reopening, and then these are the guidelines, health guidelines you have to follow to meet the condition to reopen. Those conditions are going to be set out by the health department, and so that's the key. It's not just we're not going to just let someone open and let it go wild. I think we have to have specific guidelines on how the public will remain safe. And then the idea is you reopen a set. This is what stage 2 will look like. You reopen the first set of industry, and then you sit back, you spend at least a couple of weeks, and then you monitor hospitalizations, you monitor the positivity rate, and you monitor the death rate. And you see if there are any changes, if we're doing a good job of keeping those numbers steady. and we have to be prepared that if we open in a way that is too fast, going backwards, it would be devastating to our economy. And so a lot of people say, well, just go now, reopen. If we just reopen in a way that's done too fast and we rush into it, going back to closing again, in my opinion, would be devastating for this city and our community. And remember, we have to follow the stage process. So if you're not in stage 2 of that grouping that the governor's laid out, those aren't coming next. It's only that group. And so those are some examples. The Economic Recovery Task Force, the answer to that is yes. I think that anything that ends up coming out of any of these committees, and once they're out and they're living in the public arena, of course, I think they have to be public, and we look forward to sharing those.
Next, we have Philip from Q Voice News.
Hi, I just wanted to follow up on my question from last Friday and Monday that I had for the health officers, the mayor. There was this kind of shocking resistance to wanting to collect information about the LGBTQ community, and I've heard there might be some talk about there could be some changes going on in the state in terms of that information being collected, but I really want to know what the resistance is from the health department and the mayor to collecting that. Both of you have talked about transparency and data being important. There was letters sent by Senator Scott Wiener and Assemblyman Todd Gloria April 10th to the governor, saying in part, LGBTQ individuals are at significant risk of negative health and economic impacts from the novel coronavirus. And state and counties need accurate, comprehensive data to understand the extent of the impacts. The resistance to that, almost some critics say, that you're out of touch with the community. How do you respond to that? And again, please explain the resistance you guys have to collecting it.
All right, Philip, we had a pretty your connection was cutting out a little bit. We'll do our best to try to answer your question. Dr. Davis?
Sure. The connection's bad, but I understand that your concern and your question is around collecting data regarding the LGBTQ community with regards to COVID-19. And, you know, historically, we collect the data that informs what we need to do about the particular disease. So because COVID-19 is spread in a droplet manner, which means you're sneezing or coughing or talking in front of somebody, that's what would guide our investigation, because that's what we're trying to prevent. So that is why we would collect the data that we would collect. However, the state has recently added, and they're really the ones that dictate what information we need to collect for a particular disease. And so they've recently changed their reporting form to add sexual orientation data to the form. So going forward, more of that data will be collected.
Yeah, and I'll just add that I actually absolutely support collecting that data. I know that what you collect, there's certain guidelines that the city follows as it relates to the state. And when the question has been asked the last few weeks, I know that we've been inquiring, and Dr. Davis had mentioned that the state is changing that, or recently changed that piece to collect that data. So we should be collecting it, and I support that, and I'm glad that we are. Thank you.
All right, we're checking for any more questions. No more questions.
Okay. Were there any social media questions you asked? Or we good?
Oh, hold on. Philip has one more follow-up question. Philip?
Hi, can you hear me?
Yes, your
Not very
connection.
well.
Your connection is very poor, so if you could keep your question as succinct as possible and speak loudly, that would be helpful.
Sure. I'm just, you have the authority to ask this question to the health department, and other critics were saying data is valuable, regardless if it's a respiratory illness or not, to show the impacts on the community. So I'm not quite clear why, as health officials, you would know this is important. We gotta get. There seems to be just this resistance to not understanding the significance of it.
He was saying because we have the authority to ask it, why didn't we ask it separate from what the state was doing? If I understood his correction.
Right. So we're guided by what we need to ask in order to do the job that we need to do. So there's certain diseases, hepatitis A, for instance, salmonella, where we ask, are you in a sensitive occupation? Are you a food handler? Why? Because we need to take you off of work. So there wasn't a reason that we had to ask this question up until this point. So it wasn't a resistance. There just wasn't a compelling reason that we would need to guide somebody based on that factor to change what we would recommend them doing. We're going to recommend them doing the same thing as that we would recommend everybody else. That fact does not put them at higher risk than it does for anyone else, and so that's what guided our questioning was that factor.
And I think, and it'll be asked moving forward, so I think that's a good thing, absolutely. And any other?
No additional questions.
Okay, great. So now we're going to go ahead and do a Spanish translation. And again, want to thank Alice from the Health Department.
Muchas gracias, alcalde García y doctora Davis. Muy buenas tardes a todos. Gracias por acompañarnos hoy en nuestra sesión informativa del 1 de mayo. Desde ahora tenemos 709 residentes de Long Beach que han tenido resultados positivos del coronavirus. Pero nos agradecen informarles que no ha visto un aumento en fallecimientos del coronavirus. Esta noticia es realmente maravillosa para informar. Esta semana no significa que no vamos a seguir viendo un aumento o también de números positivos, porque desde entonces saben que hemos hecho todo lo posible para agregar más sitios de pruebas. Las pruebas son muy críticas para rastrear, controlar y prevenir la propagación del coronavirus. La ampliación de las opciones de pruebas del coronavirus son prioridad de la ciudad. El aumento de la capacidad de prueba y accesibilidad nos permite trabajar de manera más inteligente y cuidar a más personas de nuestra comunidad durante esta crisis de salud. A partir de ayer hemos realizado más de 5,200 pruebas en los sitios de nuestra comunidad, juntos con más de 4,500 pruebas realizadas a través de nuestros socios laboratorios privados. Hemos tenido más de 9,600 pruebas realizadas en la ciudad desde el comienzo de esta epidemia. Nuevamente, apreciamos el apoyo de este tremendo esfuerzo del Departamento de Salud y personal de atención médica de los que trabajan en primera línea, nuestro personal de seguridad pública, que trabajan en estos sitios, nuestros trabajadores personal de la ciudad, pero un agradecimiento muy especial para los voluntarios de la Reserva Médica. Ellos son médicos, enfermeros, hacen cosas médicas o nomás ayudan en los sitios de prueba para que podamos programar las pruebas, y los médicos y voluntarios de la Reserva Médica no reciben compensación financiera. Ellos donan su tiempo y solo para apoyar a la ciudad y todos los programas que queremos tener en la comunidad de Long Beach. Muchas gracias a ellos. También queremos hablar un poquito sobre la abertura de la ciudad. Sabemos que es muy duro para la comunidad estar trabajando sin trabajo, y entendemos que todos han tenido que hacer sacrificios durante este tiempo difícil. Estos ajustes han tenido un impacto significativo y continúan haciendo una diferencia al aplanar la curva en Long Beach y que la gente esté ansiosa. Sabemos que las personas están ansiosas para volver al trabajo. Quiero reiterar que estos ajustes se basarán en la ciencia y los datos, y la prioridad seguirá siendo la seguridad y la salud de nuestra comunidad. La próxima semana anunciaremos un plan que describe los negocios y actividades que pueden comenzar a reabrirse y aquellos que requieran más tiempo y progreso para que podamos comenzar a reanudar de una manera segura. Las decisiones sobre cómo y cuándo reabrir la economía se alineará con la orden del gobernador en casa y se implementarán inmediatamente una orden de salud del oficial de la salud de la ciudad, que es la doctora Davis. Esto será en estrecha alineación con el condado de Los Ángeles y la orden de salud del gobernador Newsom. El grupo de asesor de recuperación económica se ha reunido 2 veces en las últimas semanas y está trabajando para brindar orientación sobre estrategias para que la economía de Long Beach se recupere cuando estemos listos para hacerlo. Me gustaría terminar diciendo nuevamente que estamos tan orgullosos de la comunidad de Long Beach y las formas en que nos hemos unido durante esta crisis y continuaremos superando esta crisis juntos. Estamos viendo que está sucediendo muchas más cosas con las pruebas. Hay muchos comentarios, muchas preguntas y algunas confusiones con los sitios, pero queremos decirles que hoy, a través de la asociación con el Colegio de la Ciudad de Long Beach, que está sobre la Clark y la Carson, estamos abriendo este sitio de pruebas en el estadio de veteranos. Este tendrá la capacidad de evaluar a 100 personas al día y empezó hoy, esta misma tarde a las 3 y cierran a las 6 de la tarde. Estará abierto todos los días también y este sitio es vía prueba de autoservicio también. En ese sitio están nuestros maravillosos voluntarios de la Reserva Médica, que también son estudiantes de enfermería del colegio. Además, ayer también el gobernador Newsom abrimos otro sitio en Jordan Plus, que está ubicado en el 171 Oeste Bort, sobre la calle Bort, B-O-R-T, en el norte de Long Beach, que está ubicado en el oeste de la autopista 710, que es diferente del sitio de autoservicio de la preparatoria y la escuela secundaria Jordan High School, que está en el lado este de la autopista 710. Pero el sitio de Jordan Plus está abierto de lunes a viernes de 7 de la mañana a 7 de la noche. Y ese es el que se encuentra y está trabajando los empleados del estado de California. Al igual, nosotros, otros sitios son sitios de prueba también de autoservicio. Esto eleva el número de total de sitios de pruebas comunitarias a 6, cuando incluimos el Centro Médico de St. Mary's. Al igual que en los otros sitios de prueba que han estado funcionando durante algún tiempo, puede hacer una cita para el mismo día o el día siguiente, yendo a la página de web prueba de nuestro sitio coronavirus al www.longbeach.gov/COVID-19. También puede obtener asistencia para programar una cita llamando a nuestra línea de ayuda y de información al 562-570-4636. De 8 de la mañana a 5 de la tarde, los 7 días a la semana. Como hemos mencionado, estos son todos sitios de autoservicio que es útil para mantener a las personas físicamente distantes entre sí, pero queremos asegurarnos de hacer que las pruebas sean accesibles para todos, aunque no tengan un automóvil. Entonces, en 3 de nuestros sitios, las personas ahora tienen la capacidad de recibir una prueba del coronavirus a pie. Estos sitios son en el Colegio de Long Beach sobre la PCH, la secundaria Cabrillo, que está en el West Side de Long Beach, y la escuela secundaria Jordan, que está en el norte de Long Beach. Aún debe hacer una cita a través de la página de prueba o nuestra línea de información, pero no necesita tener un carro para hacerse la prueba. Pruebas para los trabajadores esenciales. Estas son personas que están en primera línea en este momento para responder a esta pandemia. Trabajadores de los supermercados, de personal de mantenimiento, seguridad pública y nuestros trabajadores de atención médica. Aunque tengan síntomas o no. Están disponibles estas pruebas en los sitios para todos los trabajadores esenciales con o sin síntomas, queríamos recordarles. Si bien nuestra prioridad ha sido evaluar a las personas que tienen síntomas porque queremos poder identificarlos y seguir las estrategias con nuestras investigaciones. Entonces, las pruebas ahora están disponibles para los trabajadores esenciales, incluso aquellos otra vez que no tienen síntomas. Jordan Plus y el Colegio de Long Beach sobre la PCH y en el Centro Médico de St. Mary's. Los trabajadores esenciales pueden hacer una cita en nuestro sitio de pruebas o nuestra línea de información. Sabemos que hubo cierta confusión sobre Jordan y Jordan Plus, solo queremos recordarle que el sitio Jordan Plus está sobre la Board Street y ahí es donde estamos evaluando a los trabajadores esenciales que no tienen síntomas también. En todos los otros sitios, las pruebas siguen siendo prioridad para las personas con síntomas y las personas mayores de 65 años y las personas con afecciones de salud subyacentes. Y ahora eso es todo por hoy. Gracias por acompañarnos. Que tengan buenas tardes.
Y por favor, tengan un buen día a todos que están mirando y tengan una buena este sábado y domingo con su familia. Y gracias, and thank you again for watching, and we'll have a safe weekend, and we'll see everybody on Monday.